We are now joined via Zoom by co-director for the Center for Epidemiological Modeling and Analysis and associate professor from the Washington State University, Professor Thumbi Mwangi. Prof, thank you so much for your time this afternoon.
Hey, thanks. Happy to be here.
So one wonders then, with this decision, what public health measures has Kenya's Ministry of Health declared exactly, and what has informed that decision?
I think the main ones have been the lifting of the mandatory requirement to have masks and also limitations on the size of gatherings that are allowed, particularly in places of worship. And that has meant that, for indoor places, they still make a recommendation that you should keep your mask on. But if you're outside, you can go ahead and not have your mask. And also, if gatherings can actually be up to full capacity. I think the other really important one that has been made is there has been these temperature screenings almost everywhere when you go into a building. And that has been lifted, as there's not much evidence about how important that is in preventing cases moving around. The last one, I think, is one to note for international travelers. Before, they require that you must have a negative PCR test. Now, if you're vaccinated, that's no longer a requirement.
Now, in the intro, I mentioned that Kenyans will now be expected to exercise personal responsibility to stay COVID-19 free in this country, in South Africa. Some of, the restrictions have also been, limited. But there is that fear of another wave yet to hit the country. We also know and are aware of other variants that may, emanate from this. So are there any concerns, though, that, just leaving Kenyans to be responsible could perhaps also be a lot irresponsible?
Well, I think the first thing that the Cabinet Secretary for Health mentioned is that he encourages that Kenyans continue washing their hands and sanitizing, which has had a big effect in minimizing cases, not just of COVID, but we have seen a dive in the number of diarrhea cases or even cholera outbreaks that you have had. So I think that's an important thing that remains in place. Okay. To put it, I think we have to agree that we don't know much about the future, and the most important thing is to have a very good surveillance system that's able to peak when cases are beginning to rise up. So there is an emphasis that the surveillance system for Kenya continues to be really top notch, so as they're able to pick new cases when they come. And I think part of the last recommendation he made, or basically told the country, that should there be a case, a rising cases, then the government will bring back, these restrictions to make sure that the country is kept safe.
Prof, I agree. We may not know, too much about what is to happen, but we certainly can take some lessons from the past. It being exactly 2 years since the first case of COVID-19, first case was declared in Kenya. What are some of the key lessons that have been learned?
I think one big one that we have learned here is that decision making is really important to be done in accordance to science. So as government has always said, that we stick with science. So for instance, the reason why they are lifting these restrictions now is because they have observed in the last 1 month the positivity rate has actually remained below 1%. So I think that's a big lesson, that we can actually monitor and make decisions of when to increase restrictions and when to reduce them. I think the other really critical thing we have learned is we depend on our health system, and maybe during these periods of peace, we should invest more in our health systems, improve the way we are able to make our testing. Like, I think when COVID struck Kenya, we only had about 100 ICU beds. Now we have more than 600. Not a single lab would test for COVID-19. Now we have more than 100 of them testing. So I think the strengthening of health system is really our best weapon against this kind of public health emergencies.
Professor Thumbi Mwangi, thank you so much for your time this afternoon. Really do appreciate it.
Many thanks.